Welcome back, guys. Watson Michael here, and we have the great Dr. Robert Adams back with us. Retired Navy SEAL commander, retired Delta Force colonel, best-selling author of 3 books, and the most interesting part is he just put his grandchildren to bed and came after trick or treat because it's still Halloween in the US, and all the way from North Carolina. And he has put a very interesting picture. I'm not sure whether it is on Facebook or Instagram. He has put the witch on a broomstick with a naval ship, right? So, Dr. Bob, welcome back. How are you doing?
Glad to be back. Vacation. Thank you for having me, as always.
Great. So, let's start with something I think most of us have faced it. What is PTSD?
Well, hopefully most of us have not faced it, but PTSD stands for post-traumatic stress disorder. And, trauma and stress are linked in those situations. And it can be caused, because of my military background, I see it and have seen it most commonly in combat situations. But rape is a classic example of a post-traumatic stress disorder syndrome for women, and physical abuse or mental abuse by spouses, by parents, by alcoholic, caregivers is another very, very important part. So, and both men and women with sexual abuse oftentimes get the diagnosis of post-traumatic stress disorder. And, as I told you earlier, there's a story I want to tell because it's so interesting. It's a chapter in my book,
Swords and Saints.
Swords and Saints, A Doctor's Journey. And it's called the Ledford story because, I got this gentleman's permission to use his real name. He's an amazing individual, still a close friend of mine, who I met when we started fishing together 15 years ago, I guess. And we became fishing friends. And I was in the military then as an active duty colonel with Delta Force, and told him about my Navy SEAL experience. But he would never talk to me about his own military experience, just to tell me it was in Vietnam. Okay. So, I didn't push it. But he had many, many, many medical and psychological problems that as a doctor was trying to help him with. For example, he would only sleep 2 hours every 2 days.
Yeah, I remember that chapter.
Every 2 days. And I go, well, okay. And he had asthma, and he had couldn't be in crowds. And, I have severe anxiety. And his family would tell me that when they woke him up, and he had grandchildren by now, he was oftentimes violent. And I went, okay. And so I gave him treatment for his asthma and talked to him about his anxiety and tried to help him with sleep. And I'm embarrassed to say, because I think I'm a pretty good doctor, we fished together for over 6 years. Before one day he comes to me and he brings me a Bronze Star medal from his wartime in Vietnam, and he asks me, "What is this?" And I looked at it and I read it and I went, "Well, sir, this is your Bronze Star medal certificate." And he goes, "Yeah, but I don't understand. It says that he was the sole survivor of his unit as a machine gunner when it was overrun by the Vietnamese." And he goes, "I have no memory of anything like that ever happening in my life." And I went,
goodness.
"Oh no. Now I know why these symptoms you've been having are there." And I told him, Led, you have something called post-traumatic stress disorder. And by the way, this is 30 years after it happened. So these symptoms, if not treated, can last a lifetime. Now, this story has a very happy ending because, I immediately started him on a medication to help with sleep and anxiety, depression now that I knew what it was doing. And I helped him fill out the paperwork to apply for veterans benefits through the Veterans Administration here in the United States.
Yeah.
And they read his story and immediately gave him a disability rating that has been able to support him and his children ever since. So, and we're still friends to this day. And, you know, he slept through the night for the first time in 35 years after we right medicine. And his wife called me and thanked me in tears. And, you know, the reason I tell that story is to reinforce the fact that you and I are going to talk about the symptoms that people might notice in a child or an adult that has, but just remember, it can last a lifetime. And you know you have it.
Yeah.
So that's my opening story for your event tonight.
Yeah. So what are the symptoms in PTSD?
Now, that's a really big and important question, because the symptoms in a broken brain that post-traumatic stress disorder causes.
A broken brain. Okay.
Oh, yeah. Your brain does not function normally, and it shows up with certain behaviors, such as I'm afraid of everything. I have anxiety attacks. You might wake up in the middle of the night remembering something bad that happened to you, like a flashback, you know, both combat or rape or abuse. And everybody's mood is affected. You know, we think depression, but loneliness is a big problem, and loss of interest in things that are fun. So it's like, you know, what do you want to go to the movies? No. So you may have had something happen to you and friends and don't understand why you won't go out with them. Well, that mood effect shows up. Emotionally, people tend to be very detached because they can't feel love or friendship. You know, they can't even feel the tickle in your tummy that is what you and I would call happiness, that makes us laugh. And so they tend to focus just on themselves. Very detached. And many people will turn to alcohol and drugs. Not because it's an escape, but mostly because if you're suffering from what we call clinical post-traumatic stress disorder, you don't have any feelings, and they're really hard to find. Alcohol and drugs makes you feel different. So people don't like the absence of feeling, so they search it out with alcohol and drugs. And that's, you know, so there's emotional, there's the mood, there's the, you know, psychological and behavior. And if you don't put it all together, which I didn't for 6 years with my friend, you'll miss it.
Correct. Even social media, sometimes I see these youngsters, they have like similar PTSD symptoms because of social media.
Absolutely.
Yeah. So does PTSD affect only people in military, or like can it affect small children as well?
No, it affects trauma, affects all ages. And you know, there's various types of trauma. There's physical trauma, but there's also the trauma of neglect, you know, of interest. In China, during the period when only one child was allowed, girl babies were left on the side of the road, and they went to orphanages where they were fed but never touched. And so their trauma wasn't physical, it was the absence of touch. And those babies grew up, many of them got adopted all over the world, but had really, really difficult times later on in life. Now, in children that are beaten or sexually abused, they often will develop a bipolar or manic depressive type of disorder. And, you know, in the world, there's homelessness. And many people that are homeless around the world have a diagnosis called schizophrenia. They're so detached from themselves in reality that they can't function in normal society, so they can't hold jobs and they end up living on the street. And they see things that aren't there, and have horrible difficulty dealing with the world around them. And that's so it's a psychological symptom of people that have been abused. So at any age, children with sexual abuse, physical abuse, young adults, teenage rape is a very real thing. It happens. Young adults, married people that have an abusive spouse, physically, emotionally, they don't grow up normal. They become that, people with lack of feeling that have to ask for help. But the interesting part, and I've said it once, I'll say it again. A lot of these people don't know they have post-traumatic stress disorder because I told you symptoms are so broad and so many things that they just think, I'm not like other people.
Correct. Because I was reading that when you said abusive marriage, I think there was this lady once again in Swords and Saints. I think she was from Thailand or so. She had an abusive spouse, so she used to come and get some surgeries done and all. I remember.
That was a separate chapter during my surgery training, that this woman that was being abused physically, and I see this in certain Oriental nations, they somaticize, or they make their bodies hurt in the abdominal area, and the pain is very real to them. And a doctor, touches them, they go, ow. You think appendix, gallbladder, bowel perforation, whatever it is. And, we were all ready to cut this lady open and look around and find out what was in there before, I asked the surgeon, let me ask her about abuse. And that's what we discovered. That was the real issue. And we saved her from an unnecessary operation.
That's a wise thing which you did. So are there like any particular ways you can treat PTSD?
So yes, there are, but remember I told you there's the mood, there's the absence of feelings, there's the pains that aren't there, there's the flashbacks, and all of these are different areas of the brain that have been affected. So right now we are still actively looking for ways that the medical community can help treat post-traumatic stress disorder. We've recently made the news by using psychedelic mushrooms and LSD, a psychedelic trip drug from the back in the 60s. It turns out that LSD has the ability to make, in a monitored setting, the individual step away from themselves in their own mind and look at themselves, and they go, oh, I'm not normal. And then when they come back and they deal with it, they're better able to move forward. And almost everybody that lacks feeling or feels depressed or has sleep disorders, they benefit from the standard antidepressants like Prozac. Zoloft and Prozac are very popular in standard medication approaches to depression and anxiety. And it works as a symptom reliever for some of the symptoms of post-traumatic stress disorder.
Wow. Okay. Very interesting. So let's say, for example, somebody had some tremendous stress at a certain period in their life or at a certain place, and that person left that particular place or that area. After years, that person got the scent of some, let's say, flowers or plants, which was in that location where that person had so much of stress. Can it trigger PTSD?
No, not the way you're asking that question. PTSD is caused by typically more than one abnormal event. No,
Yeah.
yes, rape one time can be enough to create the condition we're discussing now, known as PTSD. And one really bad combat, event,
Yeah.
like my friend who was the sole survivor in
Yeah.
his unit when it was overrun, that's
Yeah.
a one-time event.
Yeah.
But usually there's multiple chronic stresses that change the brain's ability to function normally
Yeah.
to the point where it will be abnormal for the rest of your life.
Yeah.
And so, although coming back and revisiting things that were traumatic to you
Yeah.
is unpleasant, it doesn't make PTSD worse. What it'll typically is cause the symptoms of PTSD to be worse, and in some cases cause flashbacks.
Okay.
And
Flashbacks.
I experienced that myself
Yeah.
when I was in Iraq during the early part of the Iraqi war. I saw horrible things. I saw amputations and blast injuries and mass casualties. And 2 or 3 years later, there was a display in downtown Raleigh, the city I live in, about the Iraq war. And my wife said, "Oh, let's go into that room and see if you recognize anything." And I walked into the room equally interested and saw the pictures on the wall and was very, very unpleasantly uncomfortable. And I had to walk out. I said, so it didn't cause a flashback, but it triggered, memories that I would rather not remember. And I would say, nope, sweetheart, walking out. And the same thing would happen with anybody with PTSD if they are in an environment that they remember, it'll just make their symptoms worse.
Right. Copy that. So, any final message to all our viewers?
Yeah, I think probably the most important thing that I've said is PTSD, once it's there, it typically lasts a lifetime. It does get better over time, and it does get better with treatment. I didn't mention counseling as one of the treatment options, but it's very real and very effective. But I think the most important message I'd like to give anybody who's asking themselves as they're watching this, well, do I have PTSD? Is if you ask that question, you probably do, because most people do not know they have this condition. But because remember, the bad stuff has been pushed into the back of the mind, and you don't want to bring it out and look at it. So, if you think you might have PTSD, your loved ones know it more than you know it. So if somebody in your life, a pastor or a wife or a husband, or even a child that's looking at you says, you need to get help or ask for help or find out, my message to everybody was just ask. It doesn't hurt anything.
Correct.
Say, am I okay?
Correct, because none of us are perfect.
Right.
And for all those watching, Dr. Bob, would you mind showing your book, Swords and Saints?
Not at all. I always enjoy doing that.
There you go.
So also available on audiobook, and so you can listen to it while you're driving. But Swords and Saints, a Doctor's Journey has got some wonderful stories in it, like what we're talking about.
A great book and a very easy to read book. So just go ahead. You can find it on Amazon Kindle as well. All right. So thank you, Dr. Bob. Thank you for taking time and doing this podcast with us.
Happy Halloween to everybody. Thanks, Michael.
Thank you.